Hey, what's going on? Dr. Danny here with the PT on Smart podcast, and I got a question for you. Do you take my insurance? This is probably the question that gives cash-based physical therapists the most stress that they possibly can have in an initial discussion with a potential client. And to be honest with you, this one question and your ability to handle this correctly with potential, new patients can make or break a practice. And for us, this is something that, 12 years into having a cash-based clinic, it's a question we've answered many, many, many times. And we've helped many, many people in PT biz, the clients we work with, helping them start and grow their cash-based clinics, answer as well. And everybody's going to have slight differences in nuance and how they like to do it. But what I'm going to do today is I'm going to talk to you about a simple way in which you can redirect and reframe this to, put yourself in the best place possible to truly help this person. And also what not to do. Because there's one huge mistake that people make that doesn't put you in a great spot at all, but yet it's probably the thing that people are doing the most. So ironically, the thing that you probably naturally do is actually the thing that's going to decrease your outcomes the most. So when someone asks you, do you take my insurance? And usually this is the first thing they ask you. First thing they ask you at a workshop, first thing they ask you on a discovery call. And let me back up by saying this. It has changed quite a bit. People understand that their insurance is not great, that providers are moving away from taking insurances, and for many reasons, not just us, many different types of healthcare providers. And honestly, a lot of people in some ways view that as being a sort of superior option as a provider, whether you are or not. It's just the perception is premium more so. So this has gotten easier. It's put us in a better place. Insurance has gotten worse. This question is easier to answer. 12 years ago, when I would get this question, it was super hard. It was really hard because insurance wasn't as bad then, but it's much, much worse now. So number one, let's talk about the very first thing that you need to be aware of and what not to do. So if someone says, hey, do you take my insurance? What you do not want to do is go off on a rant about why you don't take your insurance, why third-party healthcare systems are broken, and just be incredibly negative about the entire system and how much it's screwing not just them, but everybody else with how much we pay for and how little we get and how it increases in cost every single year with truly less and less benefits to us, right? Especially people who are self-employed. So don't do what I just did, even though you might feel that way and that might be true. And the only person that probably is going to align with is someone who's self-employed, who has really shitty insurance. Even still, they're just asking because they want to know if they're going to be able to use their insurance. And you have to look at it from their side. They pay a significant amount every single month, and they would like to be able to use that. If they can't, then they understand that. That's sort of the way things are. But if you're paying, $1,000+ a month for health insurance, you probably want to use it if you can. And sadly, for a lot of people, it's basically really expensive, catastrophic health insurance, which does suck. But you don't want to go off and defend, your model. You don't want to go off and immediately, talk poorly about the healthcare system and their insurance and everything else. What you really want to do and make sure that you do is that you acknowledge that, hey, I totally understand that you want to use your insurance. I get that. It's a nuanced discussion. It's kind of complex. But before we get there, let's just make sure you're even the right fit to work with us. So what you end up doing is acknowledge that they want to use their insurance, acknowledge that it is complex. There's a lot of factors to whether, would they say they want to use their insurance? Are they truly going to be able to use their insurance in the way they're thinking? But then let's talk about why are we talking? Because I'm not even sure if you're appropriate to work with us. So let's get to that point first before we go down the insurance discussion to talk about the nuances of what your health care plan might actually, cover. Versus just saying, no, we're out of network completely. We're an out of network clinic. We don't take your insurance. All that does is basically sets up a negative start to the conversation, negative start to the relationship. And the reality is, even if you didn't, it's not the right way to go about it. Because what if they have a $6,000 deductible and they've met none of it, right? What if they have a massive copay? We just had, my son had an emergency appendix removal surgery last year. And we are still, to this day, this was 8 months ago, still getting bills from this. And it's crazy. It's just like such a pain in the ass. It's such a time suck. My wife spent an hour on the phone yesterday trying to figure out what this last little, nickel and dime bill was. And it's just so frustrating. So you have a lot of leverage when it comes to insurance, but you don't want to start there necessarily with that. So you want to redirect to, let's talk about what's going on, see if I can help. Let's clarify what's bringing you in. And then what we want to do is we want to actually listen to them, understand what's going on, hear what they have to say, see if they are the right fit for you. Because if we get people that we talk to all the time that are not the right fit for our clinic, they may have something else going on that sounds more systemic in nature. And maybe you should go see your physician first, right? Maybe you haven't talked to anybody about this. They may have something going on that is not our subspecialty. So what does it matter? At least we can listen to them and help them to redirect to the right place. That's valuable. And I'll tell you this much, like I've had patients that, or I've had potential patients that have not come in to see me, that I have referred other places because I thought they were better for whatever was going on. We number one, never diagnose on the phone. Never. You can't do that. Even if you think you're right, don't do it. It puts you in a terrible position and you might be wrong. So don't do that. Make a diagnosis in person. That's a very fair thing to say. Like, I don't diagnose on the phone. I think that's terrible practice. You really should not have somebody do that. The only way to really know what's going on is we have to do a deep dive evaluation, including a hands-on objective examination where we actually test things and we see how things are moving. We see where the root cause of the problem is. I absolutely cannot do that over the phone with you in 15 minutes. So that is a very fair thing to say. But if, let's say, somebody has something going on that's, TMJ related, that's not really our wheelhouse. I know people who are. Let's say we have somebody that comes in and it's systemic sounding. Sounds like, something else is going on. I had a lady that called me, just vague shoulder pain, no specific mechanism of injury. She had recently changed some medications. I told her she probably needed to talk to her primary care doctor first. I just want to make sure there wasn't anything going on there. She got actually frustrated with me. She said, "Hey, I've heard you're really good. I want to come and see you. You're telling me I got to go see this other person first. I feel like I'm getting a runaround." And I told her, I said, "Listen, there might be something non-musculoskeletal going on. Prefer to get that ruled out first before we waste your time, if that's not the case." So she ended up emailing us a couple weeks later. Turns out, yep, it was just sort of a side effect from the new medication she had. They changed it. Pain completely went away in her shoulder. Never saw this lady one time as a patient. She sent us tons of patients. She referred tons of people to us for true musculoskeletal problems because I, on the phone with her, told her she shouldn't come and see us. She should go see somebody else. And it was the right call. Even though for my business, at the time, could I use another visit? Absolutely. This was very early on with me starting my practice. So understanding who belongs to your office, who does not, is one of the reasons why we have these discovery calls, to make sure that we just have the right people in there. Inherently, the insurance question is the biggest barrier that a lot of people have. Once you listen to them, once you make sure they're appropriate, that's when you want to then come back to it. Say, okay, I think we can truly help you. Let's talk about insurance. At our clinic, we're considered an out-of-network clinic, so we don't directly bill your insurance clinic. That means you pay us at the time of service, and we can give you a super bill that you can then send to your insurance company to go towards your deductible, or you might get reimbursed some of it. Depends on your plan. First question would be, do you know what your deductible is, and do you know if you've met it? This is a very simple one. Most people know what their deductible is, and if they say, "Yeah, I have like a $7,000 deductible, and I haven't met any of it yet," well, this is a level playing field. Anywhere you go, even if they are in network with you, they're going to bill you a cash rate. They're going to bill you, or they're going to bill you whatever the rate is that they're billing for the codes that they have, the duration of time you're there, the things they're doing with you, and you're going to be 100% out of pocket for that. Here's the thing about that that's really frustrating. You may end up like me with my son, where you're getting bills, months after the fact, not knowing what these are for. It's very confusing. And in many cases, you end up spending far more money trying to meet your deductible, which we hopefully never happens, than if you just solve this problem with us directly, where it's simple and we have set pricing. You never get a bill from us down the line, and if we get you better, faster, with less confusion in the healthcare system, net, you're in a much better spot. We get you where you want to go much faster, right? So we can compare sort of what we can do to other clinics. The other thing you can say is, have you ever gone to a PT clinic before? What has your experience been with that? So tell me this. Have you ever been to a PT clinic before? Okay, tell me about that. What was that like? Yeah, I went in, I got on this recumbent bike. I was in there with like a bunch of other people. They gave me these band exercises to do. Maybe they did a little bit of like dry needling or something to me. And I came in a couple of days a week for like 6 weeks and it didn't get any better. Now, all of a sudden we have something to position against. What you just described is a complete opposite of how we set up our clinic. And it's the reason why we started our clinic to begin with. What you experienced was watered down physical therapy care. Sadly, that's very common in our profession. And not all professions are created equal. Not all physical therapists are created equal. Not all lawyers are created equal. Not all surgeons are created equal. Some are just frankly better than others, and some work with people in a manner that's more effective for them. When you come to work with us, we work with you one-on-one every single time. You're with the doctor the whole time. Every visit, is 60 minutes. We spend the entire hour with you. The goal is that we don't see you more than we need to solve the problem. We want to solve the root cause of the problem so this does not come back. And also, we do what is necessary to get you the outcome, not what insurance dictates that we do, or what that clinic says is just their basic protocol based on whatever you're coming in with. When you look at who we work with active adults, we work with youth athletes, we work with professional athletes, we work with people who are very high level, they're getting back to high level things. We have a lot of experience with that, and our staff is the best in the city. Like, being able to position yourself against something they've already experienced is actually incredibly powerful. And more often than not, patients have experienced physical therapy somewhere else. And I'll give you a perfect example of this, because just yesterday, I'm walking through my neighborhood. I'm walking back towards my house, and I run into two people that are old patients of mine. And they live in my neighborhood now. Their whole family actually has worked with us, but their kids are youth athletes. They're active themselves. They're super healthy for their age. They're doing awesome. And I started working with the parents originally, or I guess it was their son originally, and then the parents, and then their daughter, and but we've worked with all of them. And when I was talking to her yesterday, we were talking about her son is interested in going to physical therapy school, and she was like, we'll never go back to a traditional clinic. Like these like death by 1,000 paper cut co-pays and the extra time you have to spend there, the lack of like communication and understanding what's going on, and just sort of being thrown into this sort of like watered down system with mostly Medicare and work comp patients, because those are the people that, they still have like a lot of volume that they can get through. They reimburse pretty well. That's not the place for an active adult who's trying to continue to run half marathons or whatever, right? It's not a place for a youth athlete that's getting back to competitive soccer. It's not a place for, somebody that wants to do something that is more performance-based. Like, we talk about living a high-performance, pain-free life. We want people to help people do that, whatever that looks like for them. So when we talk to those people, it's up to us to make sure they don't get lost in the system or they end up in one of these places. And if they've already been there, what a great way to position how we're different, right? And for them, it's like, listen, just come in for the eval, right? Just come in for the eval. If you don't think that we're different after that, no harm, no foul. You'll have a very thorough examination. You'll know exactly what's going on. You can always go somewhere else to get that taken care of. But I can promise you, as soon as you step in the door and you realize that we do things differently, you're going to want to work with us, because we solve true problems. And more often than not, people that come to us haven't gotten better somewhere else. And we end up having to clean up the poor job that's been done somewhere else. That really puts you in a place where, you are teeing yourself up to show that you're different, to get them in the door, and then help them get the outcome. Now, here's the thing. The way that I say things and the way that you say things might not necessarily be the same of what you want to say. Your tone, your verbiage, your stories are going to be different based on your own experiences. I once had my office manager early on. I was like, you got to be more authoritative when you're talking to people. And she tried to do it. And we got an email from this guy that was like, I did not appreciate the way that your office manager spoke to me. She like challenged him on some things, because that's what I would do. But also, her and I are different. And what we try to do is just replicate me, and it ended up backfiring on us. And we realized, oh, well, she has a different style. She has different experiences, and she can find what works with her. And we just have to like really continue to whittle that down to what it is. So everybody's going to be a bit different. But as you look at the frameworks of this, the big keys are this. Number one, don't get defensive over insurance early on. It's not the right place to do it. You put yourself in a bad spot. Acknowledge that they should be able to use their insurance. It's a complex problem, but hey, let's figure out what's going on first. From there, listen to them, see if you can solve their problem. Make sure they're appropriate for your clinic because they might not be. Send them out. They call it your velvet rope policy. If they're not appropriate for your clinic, do not open the velvet rope and say, come on in here. You're going to get watered down outcomes. It's truly not the best place for the patient to be either. Make long-term decisions, not short-term decisions. Send them where they belong and can get the best outcome. That's going to come back to you in reciprocity. I promise you that. You may not feel it right away, but it will help. And then finally, have a discussion about what your clinic is like, why insurance is not directly part of the equation, what that looks like for them, what they might owe anyway, what does the math look like, and then also position previous experiences they've had with physical therapy against what you do, which you know is in many cases very, very different. That right there will get a lot more people across the line and the right people across the line. So I hope this helps. This is something that we see as a huge bottleneck for people, especially just starting out. They get a lot of anxiety and frustration because if they fumble this portion of the initial conversation, it's hard to come back from. And that can make or break your practice, honestly. So if this is something, by the way, that you're struggling with and you're trying to figure out all of the nuances of starting a clinic, getting patients, the sales process, growing your clinic, or if you are at scale trying to grow past yourself, trying to grow into a standalone space, trying to grow multiple schedules and increase your marketing to do so, trying to get your staff to be able to have these conversations as well on the same level or very close to what you should be doing as well. Like, this is what we do. This is who we help. PT Biz has now helped over 1,000 physical therapy clinics start, grow, and scale all across the country, Canada, and even in the UK and Australia. We've worked with people all across the world, and you don't have to try to figure this out all by yourself. I hope this is helpful for you. In fact, I'm sure that it will be. The next discovery call that you take, this probably increases the likelihood that you are going to be able to convert that person. So imagine this. From a YouTube video, a podcast, this is helpful. Imagine if you had our team where you could reach out to get help anytime that you wanted to. That's why we get such good outcomes. And it's something that sadly we see people wait way too long before they reach out for help. So if you're struggling with this stuff, you're trying to figure it out on your own, it's slow, it's expensive to do so. It's far better to find people who are trusted mentors who have done what you're trying to do and learn the skill, and then take that skill and do whatever you want with it after the fact, right? That's what we do, and we hope to empower a lot of clinicians with the right information, the right skills, the right systems, the right support and community to be able to grow these, multi-seven-figure practices that we see that are happening all across the country in these cash-based clinics and hybrid clinics that are doing the right things for their patients with low volume, the right thing with their staff with low volume, and paying them, what they deserve to make in the profession. So if you're trying to figure it out by yourself, I highly encourage you to have a conversation with our team. Head to physicaltherapybiz.com. We're here to help you. You don't have to figure it out by yourself.